great being here in Cleveland, Tom, with Cleveland Clinic. You know, I heard that you had a little startup in Middle East. Can you tell us a little bit about Cleveland Clinic Abu Dhabi and what was the challenges you faced?
Yeah, well, thanks, Saeed. Yes, first of all, thank you very much for being here. For those of you who are not in Cleveland and who came to Cleveland, welcome. This is our typical weather. So we made it special for you since you're such a tech and digital crowd. I really love the touch here with the fireside. That is virtual. But what really brings us over here to Cleveland is exactly so to say, the spirit of our organization and just the spirit in this part of the country, which I personally love. But yes, I spent 6.5 years in Middle East. I spent 6.5 years in Abu Dhabi. We started Cleveland Clinic in Abu Dhabi as a magnificent idea almost 8 or 9 years ago. And when I arrived, we had a small operations, about 35, 40 people at the most. That was in 2011. And we had only 2 docs, 3 nurses, and some of our healthcare IT and support staff on the ground. And while hospital was being built. So Cleveland Clinic in Abu Dhabi is in a magnificent building that is 4 million square foot space. So this is one of the largest constructions in the world. You've been to Dubai many times, I'm sure. So Cleveland Clinic Abu Dhabi has a larger volume of space than the tallest building in the world.
Wow.
And has also a largest glass facade than Burj Khalifa, which is the tallest building in the world that is in Dubai. So yeah, we grew our startup from 35 people 6 years ago to more than 5,500 employees today. We went from an idea to concept, and from the concept to one of the most dynamic and the largest hospitals in the Middle East that currently provides services in more than 55 different specialties at the Cleveland Clinic level. For this audience, you will love to know that it's a completely, fully digitally integrated hospital. We had about 4 kilometers of fiber optic cable in the building. There is not a single part of the Cleveland Clinic Abu Dhabi's functionality that is not being done in a digital format. We brought teams from, as I mentioned, from 80 different countries, and they have transformed the healthcare in that part of the world. So in a nutshell, this is the first time ever that we have really been able to export the excellence in U.S. hospital care outside of North America. So this is first truly American hospital outside of the U.S.
And I must say, I stopped there when you had here the Medical Innovation Summit, and we were going to announce our relationship, Cleveland Clinic, Plug and Play, and Jumpstart. I could not be physically here, so I went to the Cleveland Clinic Hospital, and I said, can I stay here? It was better than Shangri-La Hotel across the street.
Well, yeah, it was done comfortably, let's put it that way. Length of stay is a problem in that hospital. Yeah, we're a huge flat screen, it's very comfortable, but also the care is very compassionate, so our patients get much of a well-deserved attention.
Wonderful. You know, like these days, innovation is a buzzword. Everybody wants to innovate, everybody wants to digitally transform healthcare. I mean, it's a beginning of maybe with health record. And I know that Cleveland Clinic is premier health provider in the world that everybody looks up to. Can you tell us like an example of what you have done in the past? And let's say if there is, for the startups in the room, is there any areas that you like to see transform more that the startups could execute on?
Yeah. Well, we here in Cleveland have one thing that probably differentiates us from, I would like to believe, a majority of other healthcare organizations, and that is that we really have a thirst for change. Very many places that have a 100-year-old tradition get a certain degree of comfort as they mature. For us here in Cleveland, we firmly believe that we have to continue to innovate for a number of reasons. First, in order for us to provide the innovative care to our patients, we have to be willing to take forays into new territories jointly and to innovate. For us here in Cleveland, we have to wake up every morning and think about, okay, what would be the reason for someone in New York and Boston or Riyadh or London to get on a plane and fly to Cleveland, Ohio for care? So there is this imperative for excellence, and that imperative for excellence is closely linked with an imperative for innovation. We adopted electronic medical records very early because we realized the potential that electronic medical records carries. When it comes to current innovation in a digital space in particular, I believe that it spans across such a wide variety of applications and such a wide variety of opportunities. But if I were to group them or bucket them, the way at least I think about it, one is the electronic medical records and our ability to use the data intelligently. I believe that we are, so to say, right now at the stage where electronic medical record is still largely being used as a repository of information rather than the place where the information can be worked with, analyzed, and implemented in algorithms. So that's one platform. Second, there are a number of other platforms. Wearables, clearly. Then telemedicine platform is really important. And artificial intelligence. And maybe I can speak about the last two. In artificial intelligence, as you know, we have a partnership with IBM and Watson. As telemedicine is actually our fastest growing service. So if you take a look at all the services that we provide at the Cleveland Clinic, and if you were to ask me, okay, so which one is growing at the most rapid rate, that would be telemedicine. And I believe that we are at the very, very beginning of a true opportunity that telemedicine brings in patient care.
Wonderful. In fact, telemedicine is very interesting because even though you have incredible care provider, the doctors, the system, also, you could say like that Airbnb disrupted the hospitality industry. These days, they have about 2.3 million rooms without actually having a room, without cleaning even one room. So they really brought a new way of doing business.
Correct.
Going back to telemedicine, I think the trust that your brand has, you can really, I mean, like if I was a betting guy, I would say your telemedicine portion of the business will be bigger than your regular hospital business in 10 years. Do you think like you're ready to take advantage of that? And if our startups can help you to get there?
We are ready to take advantage of that. We're actually ready to take advantage on any and every initiative that would improve patient care. I mean, this is our North Star. Everything that we do as an organization, we do in such a way that benefits our patients. So we believe that there is an opportunity to transform the way that we provide care through telemedicine. I believe that there is an opportunity to personalize care and to make it more targeted to the individual need through the combination of different platforms. Telemedicine is one, artificial intelligence is another, and the list goes on and on. I think there is absolutely no doubt in my mind that this is something that will happen. We also organization doesn't wait for the things to happen to us. We like to be active participants, and we like to lead the change other than being those who adopt the change.
Wonderful. You know, you are investing $500 million in this education campus, which I saw the sort of the rendering and the video of it, and $280 million in the cancer center, which I believe is great. I mean, this is the way of future. What about pre-patient visits or post-patient visit? Because I'm living with a cancer patient right now in my house, and you know, the dramatic ups and downs that she's going through, and realistically the outside the hospital care can be improved so much. She has incredible ability with her mobile device, but I don't see post every time she goes for treatment every month, pre-treatment or post-treatment, as a personal guy that sees her in pain and unknown stuff. Do you think we could do improvement in that, in like continuous care after the visit to the hospital?
Well, first of all, I'm very sorry to hear about that. You know, there is always an opportunity to do better when it comes to patient care. You know, this is something that the optimal patient care will never be a destination. It will always be a journey. For us as an organization, we do not look at the patient care as an episode of care that only happens within our four walls. We look at the patient's recovery as a process in which we are participants in certain milestones. Our cancer care is a great example. Yes, we do have a new building, and that new building was created with an input from our patients in order to provide a really healing environment for patients who unfortunately suffer from cancer-related diseases. And by the way, today's cancer care is almost entirely outpatient, meaning very rarely, with an exception of surgical treatment, do patients need to stay in a hospital for cancer care. So that goes back to your point that a really large lion's share of care in cancer in particular happens outside of our four walls. And this is something that we definitely can do better. We are doing better because we have apps on our digital devices when our patients can access not only their records but also their providers in a real time. We have a multidisciplinary teams that are there for each and every patient need. And we're very cognizant that you know, oftentimes we treat patients with the complex chronic conditions, and we are making every attempt to come closer to them instead of mandating that they come to us for care.
You know, again, between what you just mentioned and telemedicine, I think it can really change healthcare. What do you think about the cost of healthcare in this country and the payers, the health insurance company? One of our good corporate partners, we have over 200 corporate partners. One of them is Principal Financials. And they provide insurance, they do a lot of asset management. But when I talked to the CEO, he said one of the best decisions I made in the last 5 years is get out of the health insurance business. Is because even though it costs so much, it is actually the part of insurance business that they don't make a lot of money. How could we take cost out of the paperwork, out of the claim processing, payer pays? Because if they don't make money, or at least not a lot of money, compared to the other insurance they sell, how could we get cost out of the whole system without paying you guys less?
Well, so let me just kind of put things into perspective before I answer your question. Oftentimes people say, well, the United States is allocating a disproportionate amount of their GDP towards their healthcare, yet the outcomes are not as good as they are in some other countries, and the list goes on and on. But when you take a look at actual determinants of health, then a healthcare is actually a relatively small fraction of a determinants of health for populations. Education, socioeconomic factors, ability and availability of social services play a very, very large proportion in determining whether a population or a nation or a community stays healthy. And if you take into account of the money that the United States allocates in aggregate for social services, for education, and so on, and put it on top of our healthcare expenditure and take a look at those buckets in aggregate, you will find that the United States is in the middle of the pack of the developed Western countries, the way we call the developed Western world, when it comes to the expenditure, dollar expenditure for an individual for health. So this is, I think, a really, really important context for people to understand. So we have a relatively large expenditure for healthcare, but we have a very, very small expenditure for other services that are equally or more important determinants of health. So now going back, so what can we do to make healthcare more efficient and make healthcare better? A number of things, obviously. But I'll always like to start with the contextual background. There is no industry, to my mind, and I mean, you have such a good insight through your work, the entire world, is that right, when it comes to various industries. I cannot think of a more complex industry in the world than a provision of health. Is that right?
Oh, it's very complex and personal.
And so, but it's complex for a number of reasons, is that right? Do you know any industry that provides such a wide spectrum of services? Any industry that employs such a highly sophisticated workforce, that requires such a strong infrastructure, from physical plants to informatics, and that is as highly regulated as healthcare. So this is not, there is no silver bullet for this, but there are still a number of things that we need to do in order to get better. Coordination of care first and foremost, and a laser focus to the quality of care. The most expensive care is the one that is associated with highest degree of complications and the lowest quality. So good care translates into lower cost. Better coordination of care is really important. You know, we put a lot of money into trying to figure out what is a cure, let's say, for cancer. We, however, rarely study the actual way to take care of cancer patients, to use your example. Is that right? So the processes of care are less refined and less frequently investigated than the actual studies of disease processes. And the other opportunities, obviously, to agglomerate and get larger as healthcare providers. You know, healthcare is a $3 trillion industry in the United States. If you take a look at from the provider perspective, the largest providers in the United States cover at the most 2 to 3% of the US market. So that is clear that in all other industries, you know, typically we have 4 or 5 dominant players in the market that cover 60, 70% of the market. And it is not like that in healthcare. So we're seeing it already, and I believe we're going to continue to see is an agglomeration, both horizontally and vertically, and integration in order to get scale, in order to put efficiencies that our industry needs for the benefit of the patients and the society. So it's a long-winded answer to a simple question.
No, but I really do agree with you that, you know, even like, you know, going to get a test and then waiting for the lab's answer and then rescheduling the doctor's visit, if the periodic sort of happens more systematically, it would take cost out. And then I come to prevention. Let's say if you can prevent getting sick, there is a company we little bit worked with, it's called Vitality, that it's a health insurance that gives you an Apple Watch if you walk more this month. And they send to their clients walking shoes that have proven to be the best. Do you think we could do better in preventive care and in healthier food? I shouldn't say this looking like this. I should be looking more like you when I say this. Thin and trim and fit. But what do you think about that?
Well, I think I'll just assume that you know the answer to the question. Of course, we can do much more. That goes back to the example that said the social determinants of health, the way we eat, the way we move, environments in which you live, the education that you receive, are much more important determinants of longevity of an individual or community than is an actual healthcare facility in their neighborhood. So that is really what we need to focus on in order to really do what is right, not for an individual, but to do what is right for society. And I'm a huge proponent of prevention. I believe that we can do a lot when it comes to better nutrition. I'll tell you the silent epidemics that is, I don't believe as silent any longer, is childhood obesity. And that is now rampant, and it's a true source of concern for me. And there are a number of different examples that we can do to keep ourselves healthier.
That's great. You know, if I could go back to your Abu Dhabi or Cleveland Clinic Abu Dhabi as a startup, starting with 35 people and reaching 5,000 people, and then taking Cleveland Clinic Cleveland. I'm not exactly sure, but I think you have over 30,000 employees.
57.
Okay, I'm way off.
Yeah.
But, you know, I have seen front seat Google start with 3 people in my building. And then now in the Mountain View campus, they have over 35,000 people. Globally, 70,000 people. And just to add a little sort of story to it, the person who built the business model for Google is Omid Kordestani. He's my best friend. And he built the company from 0 to $10 billion revenue faster than anybody in history before. Do you think in the health tech industry, together with Cleveland Clinic, we could seed fund a company that would be similar to Google, that could create incredible high-paying jobs here and bring the best technologies and the best ideas startup to come here, and with the help of Cleveland Clinic, do rapid prototyping, launch it out, and then expand? Again, I always say, let's dream big. I would like to have 100 companies in Cleveland with your help and Jumpstart, but I would like 5 of them to turn out to be like Google or Airbnb. Do you think we can do this together?
Well, I certainly think that we can do a lot together.
Not that, I just want another Google or another Airbnb,
yeah,
you know?
Just another Google and just another Airbnb. So I believe that we can do together in all seriousness. I believe that there is, what we do understand as an organization is that when it comes to the digital technology and information of development of digital technology, we have to rely on partnerships. A lot that we have done in the area of our primary competency, which is provision of care, we have done with our own ability, with our own talent. Times have changed for better. I'm very excited about healthcare. I think this is probably one of the most exciting era in healthcare ever. And the ability for the large organizations like ours to create productive partnerships and hopefully create a Google, the new Google of healthcare would be very, very exciting. It would be exciting for Cleveland Clinic. It would be exciting for the city of Cleveland and for our community here, but it would be exciting for millions and millions of patients that we serve, because we are a Cleveland company. We are a Cleveland organization, but we are also a global organization at the same time.
Wonderful. Now I would like to put you a little bit in a position of empowering your hospital to really work toward this relationship. You know, when Dr. Seche from Mercedes, the CEO, said, Saeed, what you're doing in Silicon Valley is quite unique and special, and Mercedes has been working with us for over 5 years. And we did, on average, 3 pilots with Mercedes while they came to visit us in Silicon Valley, and we showed them startups, and specifically in one day, they also invested in 3 of our startups. But when we moved this innovation platform to Stuttgart, on the request of Mercedes, and now we have Porsche on the same platform, BASF, ZF, Mercedes last year did 30 pilots with 8 different business units. So Dr. Seche asked the different business units, please collaborate with Plug and Play. Tell us where the areas of interest are. And when we looked for startups globally, quite frankly, the first batch, we only had 2 German startups. We had to import everybody to Stuttgart. Mercedes now has culturally changed, so now they embrace ideas from outside. Even though they have a great engineering team, 70,000 people, they did 30 pilots, and 6 of the pilots are actually going into production. And you know, I must admit, it's not easy dealing with the Germans. They are a little bit square and very systematic. But we've been able to do that there. Do you think we could do a similar, this is putting you on the spot, thing here with Cleveland Clinic? Can you mobilize your troops to do 30 pilots? If not, the first year they did 15. The second year they did 30.
Yeah. So one thing about Cleveland Clinic and people that we have in our organization is such that I do not have to mobilize anyone. I have to hold them back instead of mobilizing. So we're an organization that leans in every single day. We are not the organization that has to be encouraged to do what is right. And we like to think of ourselves as responsibly entrepreneurial and very much open to other ideas. We're a very diverse enterprise. This is our source of pride, and this is our source of strength. So I'm in a very, very fortunate position that I do not have to give people ideas and initiatives. I'm here to enable their own energy and their own intellectual potential.
I think that's an unbelievable answer, but still let's push them a little too. Or at least let's not hold them back.
If I can catch them, that's the problem. You can only push people who are slower than you are.
Yeah. But it's a great pleasure being in Cleveland, being with Cleveland Clinic, Tom, and we really look forward to a long-term And I always say mutual beneficial relationship, not only for Cleveland Clinic, not only for Plug and Play and Jumpstart, but for the Cleveland as a whole, and most importantly, our entrepreneurs. And we would like to...
And most importantly, for our patients.
I like that. Consumer first.
Yeah.
So customer first.
Yeah.
So with that, thank you so much for joining me at this.
Thank you for
a little bit too
hospitality.
much heat back here.
Yeah,
huh?
yeah, it's been just burning. Yeah.
So I have a gift for you.
Okay.
Because people make fun of me that I always wear a vest.
Okay.
So
Oh, thank you very much. So this fits the Cleveland Clinic code of dress code. For those of you who know me, yeah. But thank you very much.
Thank you so much. Great. It was great fun. It was great fun. Thank you.
Thank you very much.
Thank you.